Well, thank you, Godley, for that. It was very gracious. Really a treat to be here. It's particularly a treat. I remember a baseball player, Mickey, who played for the Washington. He won the batting title one year. I'm a pretty good hitter. I must say I'm more pleased after World War II when there was a person by the name of Dr. Ansel Keys, and his colleagues went to several countries around the world, and I conclude from those studies this statement: atherosclerotic plaques large enough to produce clinical problems occur only in persons having serum or plasma total cholesterol levels greater than 150. Now again, not many of us in this audience, I suspect, are going to have total cholesterol levels around 150. But that's the ideal. That's the goal that we really should shoot for. Now the next three items, 4, 5, and 6, will really solidify the last decade. That is, the higher the blood total cholesterol level, the greater the chance of having symptomatic atherosclerotic disease, the greater the chance of dying from atherosclerotic disease, and the greater the extent of the atherosclerotic plaques. This item 5 cost you and me as taxpayers millions of dollars. These studies will never be repeated, and they cost too much. Look, the question in this number 5 was asked: if you take a group of people who have high cholesterol levels and you lower these cholesterol levels, will one decrease the frequency of getting a heart attack? And the answer, a resounding yes. Item 6, 5 major studies on item 6 were published in 1990, and that is atherosclerotic plaques have the potential to regress, that is, shrink, when high blood cholesterol levels are lowered. Now, this is really good news, folks. It means that even if you have a heart attack, there's no need to give up. Just get that cholesterol lower, and these plaques can shrink. That's very good news. Now, this is one of Ansel Keys' slides. This is the famous 7-nation study. He went and his colleagues to these 7 countries and found a very low frequency of symptomatic coronary artery disease in certain countries like Japan and Greece, and a very high frequency of symptomatic coronary disease in some other countries like the USA and Finland. Now, these studies were conducted in the 1960s, and at that time the Japanese were eating only 25% as much fat and cholesterol in their diet as we were, and even less than that compared to Finland. Now today the Japanese have gone up in the quantity of fat that they eat, so they too now are getting a symptomatic atherosclerotic disease just like we have in this country. Now, this is one of Ansel Keys' slides. He studied a group of people in southern Japan. Their average total cholesterol was 150, and the group in East Finland, it was approaching 300. Marked difference. He concluded that this atherosclerosis was a cholesterol problem. You get the cholesterol down, you don't have to worry about it. Now, this is a study from Chicago called the Mr. Fit study by Stamler and his associates, published in 1986. The remarkable feature of this study is look how many people were studied. Over 350,000. In other words, over 7 football fields filled with people. They were all men, sorry ladies, aged 35 to 57. They were all asymptomatic, no clinical evidence of heart disease, and they were divided into 10 groups according to their total cholesterol level. And what this study shows so nicely As that cholesterol level goes up, 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 and up, the coronary artery mortality, and that's only for 6 years, it's higher at 10 years, it's higher at 12 years, it's higher at 15 years, goes up, 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 and up. No study shows it any better, that this cholesterol is a quantity. The higher the quantity, the greater the risk. Does everybody know their cholesterol level? Write it down. Put it in your wallet. Put it in your purse. When your doctor takes your blood pressure, write it down. Put it in your wallet. Put it in your purse. Don't accept that my doctor says my cholesterol is normal. Ask he or she what it is and write it down so you have a record of it. Now, this busy slide here has to do with 2 major studies. The one on the left here, this is a summary slide in a study that cost $158 million. Now, what was done, both of these studies are the same, and these are what are called primary prevention trials. And that is, you take a group of people who clinically have no evidence of heart disease, but they have very high cholesterol levels. This group that was studied had total cholesterol levels greater than 265. And then you take these group of people and you put 1/2 of the group on a cholesterol-lowering drug, and the other group gets a placebo. And then you look at them 7 years later, 5 years later, and what these 2 studies show is that if you take a group of people with high cholesterol levels and you lower them, that you decrease the frequency of heart attack. In this study it was 19%, in this study it was 34%. Now, I'm here to tell you that these percent reductions are very conservative because of the way in which these studies were set up. In other words, these studies were set up by what the statisticians call intention to treat method. Now, what that means is let's say you were put in the drug arm of the study, this dashed line. Now, if you take the drug for a few days and then you quit, even though you quit, you stay in the drug arm of the study throughout its entire length. And that's the way this study was set up too. Now, if you really compare the group of people who took the drug in the quantity that they're supposed to have taken it, for the length of time that they're supposed to have taken it, there was in this particular study, there was a 25% reduction in total cholesterol, and not a 19% reduction in heart attack, but a 50% reduction in heart attack. In other words, if you get that cholesterol level down, folks, it makes big difference, and I'll come back to that point. This is in essence what those studies showed. If you take the total cholesterol and look at it as a percent, for every 10% it drops, your heart attack frequency drops at least 20% and more likely 30%. Now, what does a 10% drop in cholesterol really mean? Let's say your total cholesterol is 200. A 10% drop would drop that total cholesterol to 180. And that would mean with only 10% drop, you would drop your frequency of heart attack probably 30%. Now, this complicated slide here has to do with what in medicine are called secondary prevention trials. Now, what does secondary prevention trials mean? It means that you take a population, not a healthy population as in the primary prevention trials, but a group of people who've already had a heart attack. And then you take half the group and put them on a diet or a drug or even a partial ileal bypass. If you take out part of the small intestine, you can drop your total cholesterol level a great deal because that's where a lot of it is absorbed. But what these studies show is even in people who have had heart attacks, if you drop your total and specifically the LDL cholesterol, that's really the bad one, but that makes up the majority of the total cholesterol. If you drop your total cholesterol because of these various regimes, the chance of getting another heart attack is reduced dramatically. In this study, 33%, 25%, 35%, 80%, 70%, 43%. Not a single study showed that the subsequent heart attack frequency was not reduced. Now, folks, if you have a heart attack, you learn what your cholesterol level is and get it down, 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 and it pays big dividends. Now, in addition to that, some of the plaque can disappear. Let's say you have a total cholesterol level of 225, and a total cholesterol level of 225 is one of the most dangerous levels in the USA, because most people with heart attacks have total cholesterols between 200 and 240. Very high cholesterols, that is over 240 or over 265, only 5% of the population have total cholesterols over 265. Most of the population between 200 and 240. The most dangerous number is 225. That's the average total cholesterol level of people with heart attacks in coronary care units around the country. But if you can get that total cholesterol from 225 back down to about 160, this atherosclerotic plaque, which has caused over 75% luminal narrowing, and at that level you slow flow through the artery. If you can get some of this plaque out of there and shrink it down to here, this artery will open up such that the lumen, the inside, is now less than 75% narrowed, and that is as if there is no narrowing at all. So this means that small reductions in the mass of the plaque, if you can get some of it out, can really lead to big increases in the area for flow of blood. Now let me switch gears again to nutrition. Nutrition is a very tricky subject. That is what we put in our mouth every day. When I was in medical school, and that was a long time ago now, we didn't have a single lecture on nutrition in my 4 years in medical school. When I graduated from medical school, I didn't know the caloric content of a single food. I ate all the hamburgers, hot dogs I could find, and usually when I sat down, before I ever tasted a bite, I would pour salt all over these foods. And in the last 15 years or so, I've been a collector of diet books, and I think our fate is more determined by what we put in our mouth than anything else. Now, this is a slide that has to do with cholesterol, and what it shows from 3 different groups of investigators, that if we increase our cholesterol intake, our cholesterol in our blood will go up. All 3 groups showed the same thing. Now, that's the way it is with groups of people. In any single individual, there is a good bit of variability. One person can eat 3 eggs and the cholesterol level will shoot up. Another person can eat 3 eggs and the cholesterol level is barely moved. So there is individual variability. But in groups of people, the more cholesterol we eat, the higher it is in our blood. Now, cholesterol is sort of easy to give up, actually. Cholesterol, as you know, comes from animals in their products. So if we don't eat any animals in their products, we don't take in any cholesterol. All animals have cholesterol. There's no cholesterol in plants. I'm always amused when I go in a grocery store and go by the peanut butter counter and it says on certain peanut butters, no cholesterol's in here. Well, of course it's not. It's not an animal. Only animals have cholesterol. All animals have saturated fat except for fish, and that's one of the good things about fish, which is more mono or polyunsaturated. The only plants with significant amount of saturated fats, I'll come back to this in a moment, are the palm trees, coconut oil and palm oil. At room temperature, saturated fat is solid. You can remember, S is S. Saturated is solid. Unsaturated is liquid. So if you've got some grease in your frying pan, if at room temperature that grease is solid, you know it's saturated, and that means it's bad. Now, as a matter of fact, I don't worry too much about cholesterol. And the reason for that is that most of us in the USA take in a relatively small quantity of it. That is a half a gram. That's 500 milligrams. Now, how do you picture 500 milligrams? I can tell you that a toothpick weighs 100 milligrams. So most of us in the USA take in the equivalent of 5 toothpicks of cholesterol every day. It's so small there's hardly a calorie in there. And half of the cholesterol we take in comes from the visible and non-visible eggs we eat. So if we give up the eggs, we're going to give up half the cholesterol. If we give up red meat, we'll take care of the cholesterol problem. Now, the bad one, in my view, is FAT, fat. Now, unfortunately, a lot of Americans take in over 140 grams of fat every day. I live in Texas now. I can tell you there are some Texans who take in 300 grams of fat every day. None of us should take in over 75 grams of fat. Probably no man should take in over 60 grams of fat. And ladies, none of you should take in probably over 50 grams of fat. Now, how do you picture that? I can tell you that a deck of cards weighs 75 grams. So none of us should take in more fat than about 75 grams. Now, the problem with fat is about a third of it is saturated. Now, when that saturated fat enters our bodies, it is essentially turned into cholesterol. So let's say we take in 120 grams of fat. That means on the average that about 40 grams is saturated. So when that 40 grams of saturated fat enters our bodies, we make 40 grams of cholesterol. Not a very good thing to do. Now, every fatty acid has not only saturated fat, monounsaturated, and also polyunsaturated. Now, the saturated clearly raise our total cholesterol and our LDL cholesterol, which is the bad one. The monounsaturated and the polyunsaturated either have a neutral effect on our cholesterol levels or they lower them. Irrespective of that, all of these fatty acids have a lot of calories in them. But we need to stay away from the ones in this column. Coconut oil, 92% saturated fat. Palm kernel oil, 85% saturated fat. Butterfat, 66%. Beef tallow, 52%. Now look at these over here. There's some evidence that monounsaturated is better for us than polyunsaturated. Look at olive oil, 77% monounsaturated. Those Italians and Greeks, they know what they're doing. A lot of olive oil. Peanut butter is nearly half monounsaturated. Now, folks, if you really want a good, quick grease job, there's no better place to get it than the fast food chain. Now, Michael Jacobson and Sarah Fritzner from Washington went around to the top 15 fast food chains and tried to determine the ingredients of the foods. Now, you know, the fast food industry, it's over a $75 billion industry in this country. 20% of Americans eat their lunch every day at a fast food chain, 13% their supper, and 5% their breakfast. Now, let's look at the ingredients of the hamburgers. Well, folks, Wendy's triple cheeseburger, this is the coronary artery bypass special. And it's closely followed by the Burger King double beef whopper with cheese. We are talking about, in that single hamburger, about 1,000 calories. And if you take that sucker and squeeze it real hard, you can come up with 15 teaspoons, not grams, but teaspoons of fat in that single hamburger, and much of that is saturated. And this little word here is sodium. Now, we shouldn't take in men over 4,000 milligrams of sodium, women about 3,000 milligrams. That's max. We probably in a lot less than that. But look at some of these hamburgers. Here's nearly 2,000 milligrams of sodium right there. This is not salt. This is sodium alone. 1,200, 1,800, 1,000. Watch out. I'll have the half-pound double deluxe bacon steer burger, please. You want chemotherapy with that? This fella, John Love, wrote an interesting book. He entitled it McDonald's Behind the Arches. I've got a good friend, Bill Castelli, who heads the Framingham, Massachusetts program, where they've done such wonderful work in the past 25 years. Castelli calls these arches of McDonald's the entrances into the pearly gates, and I think he's right. Look at this number 2. Slightly more than 50% of the population of the USA lives within 3 minutes of a McDonald's. This is an old slide. McDonald's has served over 90 billion hamburgers, and think how many atherosclerotic plaques. McDonald's is the biggest purchaser or killer of cows in the country, depending on your perspective. Since they started Chicken McNuggets, they're the second biggest purchaser of the chickens. They're the biggest purchaser of the potato crop. Look at this number 8. McDonald's has employed at one time or another over 8 million workers, 7% of the entire U.S. workforce, and McDonald's has replaced the U.S. Army as America's largest job training organization. Folks, that's power. There was a fellow named Hall who wrote a wonderful book. He entitled it In One Day. And the question he asked is, what do we consume in the USA every 24 hours? Well, about 815 billion calories of food are consumed every day, roughly 200 billion more than we need. Now, these 200 billion left over feed the whole country of Mexico every day, no problem. In 1990, folks, we reached 60%. 3 out of every 5 adults aged 18 and over in the USA are overweight, and 30%, frankly, obese. When I was at NIH, we had a lot of foreign visitors there. I would always ask them when they'd come in my office, what strikes you most about Americans? And of course, that produced a lot of different answers, but the most common answer was how many fat people we have in the USA. No country in the history of the world has seen the equivalent of what we have in this nation. Nearly 100,000 cattle are slaughtered every day in the USA, yielding 60 million pounds of red meat. And as you know, I'm comfortable being in Texas now and talking about this, but this is where, that's the original cowboy country. This is where it started. As you know, in the USA and Canada, we handle these cows differently than anywhere else in the world. During their last 6 months of life, we bring them into these feedlots, and there we feed them 20, 25 pounds of grain and soybean every day. And why do we do that? We do that, of course, to make them fat. And why do we want them to be fat? Because they taste better. And that's the way it works. We also kill about 250,000 hogs every day and eat 4 million pounds of bacon every day. Bacon is about 85% pure fat. Now, if you don't know what it is, make a hot dog out of it. We eat about 47 million of them every day. McDonald's puts 2,500 cattle on their tables every day. Dairy cows yield 47 million gallons of milk every day. We eat 170 million eggs every day. And folks, if you're a chicken, don't wander into the USA, because we kill about 12 million chickens every day. We eat 50 million pounds of sugar every day, an average of 21 teaspoons apiece. Can you imagine waking up in the morning, looking at your bedside table and seeing 21 teaspoons of sugar there? These processed foods that we all eat are loaded with sugar, and they're loaded with salt. We also eat about 3 million gallons of ice cream every day, and there's more sugar in the ketchup for our hamburgers and hot dogs than there is in ice cream. We also eat about 10 million pounds of candy every day. We drink 16 million gallons of beer and ale each day, and 1.5 million gallons of hard liquor, enough to make 26 million Americans thoroughly drunk every day. We still smoke about 85 million packs of cigarettes. We still have 45 million cigarette smokers in this nation. I'm proud to say physicians are down to 3%. Medical students in the USA, I understand, are now down to 2%. I like this statement by William Collins. He says, the carnivore animal has almost an unlimited capacity to handle saturated fats and cholesterol, whereas the vegetarian and herbivorous animals have a very restricted capacity to handle these food components. It is virtually impossible to produce atherosclerosis in the dog. Even when 100 grams of cholesterol, and that's 200 times the average daily intake for humans in the USA, plus 120 grams, that's equivalent to 1/4 pound of butterfat, are added to its meat ration. Adding only 2 grams of cholesterol daily to a rabbit's chow for 2 months produces striking fatty changes in its arterial wall. So are we more like the rabbit or more like the dog? Let's examine that a little closer. Now, here are some characteristics of carnivores and herbivores. Now, when you look down at your appendages, do you see claws or do you see hands we're supposed to be using for gathering these fruits and vegetables we're supposed to be eating? Now, there are a lot of people argue, well, the teeth in the front of our mouth are sharp, but most of our teeth are flat for grinding those fruits and vegetables. Now, our intestinal tract is very long. The small intestine of a human is 26 feet long. I mean, that would stretch a long way across this stage. Now, in contrast, you give your dog or cat something to eat, they got to go outside in a few minutes. They have a very short intestinal tract. Now, when you cool your body, do you pant like a dog or do you sweat? When you drink water, do you lap it like your cat or do you sip it? Now, vitamin C, the carnivores make their own vitamin C. Human beings, no, we obtain ours from our diet. So I think we're one of these carnivores, and we certainly conduct our lives as if we are, but I would suggest, as have many others, that no, fundamentally, we're one of these. Now, suppose we could divide us in this room into 2 groups and put the pure vegetarians against that wall over there. I'm talking about not pure vegetarians for a meal or for a week or a month or a year, but for a long period of time. And against this wall over here, put the meat eaters, which most of us are, and ask, what diseases do the vegetarians over there not get that these meat eaters over here get? Well, the pure vegetarians, they're not bothered by sclerosis. Sclerosis is going to kill 50% of us in this room. But those pure vegetarians over there, they don't get it. High blood pressure in the U.S. alone, we have 60 million people with blood pressures greater than 60 million. And we have a lot. Our blood is 90/60. In societies where they eat no salt, that blood pressure is 60 throughout an entire lifetime. We eat about 10 grams of salt every day, and our blood is to go up with age. But that's not normal, it's abnormal. But pure vegetarians, they're not bothered with it. Pure vegetarians have a very low frequency of cancer of the colon, cancer of the breast. Now, these are 2 of the 3 most common cancers, and the pure vegetarians don't have to worry about it. Prostate gland cancer, I saw the other day, frequency of cancer of the prostate gland than light meat eaters. Diabetes mellitus, 50, is extremely uncommon in pure vegetarians. They're not obese. They're not bothered by peptic ulcers, constipation, hemorrhoids, diverticulosis, appendicitis, hiatal hernia, irritable bowel syndrome. The gastroenterologist, general surgeon would be out of business if we were all pure vegetarians. They don't get gallstones, folks, or kidney stones. Osteoarthritis or osteoporosis. Osteoporosis, it's estimated in this country that by age 65, woman has lost 35% of her skeleton. Why? Because we're not taking in enough calcium? Almost surely because we're taking in too much protein and we're taking in too much salt. The more protein we eat, the more salt we eat, the more calcium we lose in the urine. I saw this statement recently. A person who eats meat is personally responsible for the slaughter of 22 warm-blooded animals per year, 1,500 in a lifetime, etc. animals killed in laboratories and so on chicken feed compared to the other. Now this is a slide I took from the JMA. That's the Journal of the American Medical Association. It has to do with cancer of the breast. Well, why are we talking about cancer of the breast? Well, what we see here is the USA right up here. And these are adults in these various countries around the world. And what we see on the horizontal axis here is the grams of fat consumed on the average by people living in these various countries. And on the vertical axis here, this is the death rate from cancer of the breast. And we have one of the highest frequencies of cancer of the breast in the world. Societies that eat very little fat have a very low frequency of cancer of the breast. Well, this could also be cancer of the colon. The lower the quantity of fat eaten by a society, the lower the frequency of cancer of the colon. And of course, it could be high blood pressure. The lower the quantity of fat eaten by a society, the lower the blood pressure. And of course, it could be atherosclerosis. The lower the quantity of fat eaten by a society, the lower the blood pressure. We're talking about fat, which is responsible for at least our most common cardiovascular disease, atherosclerosis. It plays a major role in high blood pressure, and it plays a major role in 2 of our 3 most common cancers. Can we improve our health? Of course we can. When we pull that chair up to the table 21 times a week, folks, we're determining whether we get many of these diseases. Now, this is a study that came out of the Harvard School of Public Health. It has to do with body weight and when we die. They call it mortality ratio, but that means when we die. And what this shows, whether you're man or whether you're woman, the more we weigh, the sooner we die. Now, we can all point to the exceptions. We can point to the Winston Churchills. But when you're dealing with groups of people, the more we weigh, the sooner we die. Now, this is a slide, unfortunately, it took World War II to produce, 1939 to 1945. And as you know, during that period of time, in certain countries on planet Earth, there was not much butter, and there was not much cheese, and there was not much milk, and there was not much meat. And look what happened to the cardiovascular death rate in Sweden. Boom, it fell in Finland. Boom, it fell in Norway. Boom, it fell in USA. It just kept on going up. Can we change our health? Of course we can. Now, this is the most commonly prescribed diet by physicians in the USA, and that is a 30% of calories from fat. Now, this is the tricky thing. What is your percent of calories from fat? Well, for me to maintain, and the question is, how many calories can you take in and maintain an ideal body weight? Well, for me, I'm 6 feet tall. I like to weigh under 170 pounds, so I have to limit my calories to approximately 2,300 a day. Now, if I'm on a 30% of calories from fat diet, I can take in no more than 75 grams of fat every day. I probably should take in less than that. But if we lower our percent of calories from fat from 40% or 38%, which is the average now, down here to 30%, what does that do to our total cholesterol level? What does that do to our LDL cholesterol level? This is the most commonly prescribed diet for people with heart disease in this country. Well, the answer to that question, it lowers our total cholesterol level by 5%. It lowers our LDL level by 5%. In other words, it's chicken feed. If we're going to make a dent in our health, we've got to get our percent of calories from fat down from nearly 40% down here at least to 20%. And if we can get them down to 20%, that'll lower our cholesterol level approximately 20%. In other words, if our levels are 200, it'll knock it down to 160. If we get it down to 30%, if our level is 200, it'll only knock it down to 190. So we need to decrease the fat considerably. Now, these are cholesterol-lowering drugs. These last 3 came in since 1987. They're really splendid drugs. We have approximately 1.5 million Americans on cholesterol-lowering drugs. In my view, we should have many more than that on these drugs. Particularly, we should have, in my view, everybody who's had a heart attack ought to be on a lipid-lowering drug unless there's a major contraindication, in my view. If I had a heart attack, I guarantee you I'd be on a cholesterol-lowering drug right away, irrespective of what my cholesterol levels were, because whatever they were, they would be too high for me. Now, this is a coronary artery in somebody who had angioplasty. That is, the catheter was put in here, the balloon went off, and it cracked this plaque. That's the way it worked, and dilated that artery, so now we have more space for the blood to flow through. But that wonderful procedure, angioplasty, balloon going off and so on, it doesn't take away this atherosclerotic plaque. It's still there. And now we've got to keep that plaque from growing. And if the cholesterol level is brought way down, plaques can be stopped in there, stopped immediately. But we have to get these levels way down. Now, this is a saphenous vein right here. This is a vein that's in our legs normally. And this vein in this particular patient was taken out 5 years earlier and used it for a bypass conduit. That is, it went from the aorta down to a distal coronary artery, bypassing areas of narrowing. And now we look at this saphenous vein, this brand new coronary artery 5 years later, and here it is filled up with atherosclerotic plaque. In my view, virtually everybody who's had a bypass operation should be on a cholesterol-lowering drug, as well as a cholesterol fat-lowering diet. Now, this is an important slide here. This line represents people who've never had an atherosclerotic event. They've never had a heart attack. They've never had peripheral vascular disease. This line, secondary prevention, means that these people have had a heart attack and they survived it. This line is the cholesterol levels, and this line is the various risks of developing a heart attack for the first time, if for primary prevention, or the second time, a third time with secondary prevention. Now, what we see here, let's say you've not had a heart attack, but you have a high cholesterol level. Let's say it's 310. If you get that level down to 270, you reduce your chance of having a heart attack in half. If you knock it from 270 to 230, you reduce it in half again. If you knock it from 230 to 190, you bring it down to an average. Secondary prevention, and here are people who've had a heart attack. It shifts that line to the left. But if you start out with a cholesterol of 270 and you get it down to 230, you drop your chances of having another heart attack in half. If you go from 230 to 190, you drop it in half again. If you go from 190 down here to 160, you really are doing some good. It pays big dividends, folks. Now, this is a slide I made in 1972 after seeing some studies done on the frequency American population knew whether or not they had high blood pressure. Now, in 1972, for every 100 people with high blood pressure, 40 were unaware that they had it. And of the 60 who knew that they had high blood pressure, 30 were not seeing a physician. And of the 30 seeing a physician, only 15 were having it adequately treated. Now, that's terrible. In 1994, this number here is not 15%, but it's over 50%. Now, if you want to decrease your chances enormously of having a stroke, just get your blood pressure down. And stroke has dropped in the last 20 years approximately 50% in frequency. Now, suppose we substituted here hypercholesterolemia, that is high cholesterol levels rather than hypertension, and went through this scenario. What percent of the American population with high cholesterol levels are being adequately treated? And I will tell you, folks, it's less than 5%. So we have a bottomless pit here almost. There are few societies on planet Earth who still today do not develop atherosclerosis. And if you look at these societies, you see where they are. There are fewer and fewer every decade. They have very low blood cholesterol levels, no hypertension, they do plenty of physical exertion, they do not use tobacco, and their diets are low in total fat and they have more polyunsaturated than saturated fatty acids. Their blood is even thinner than ours. Now these are coronary arteries. Again, the arteries which supply our heart muscle. But these are arteries of a woman who was 103 years of age. Now this is her left main coronary artery. Beautiful. I'll trade with her right now. This is her right coronary artery. That's the biggest plaque in her body right there. This is the left anterior descending, the one in front of the heart. Now these are wonderful looking coronary arteries. The reason I show this is that atherosclerosis is not a degenerative disease. We don't have to get it just because we get older. I'm afraid we are the degenerates, not the disease. I like Mark Twain's statement, the only way to keep healthy is to eat what you don't want, drink what you don't like, and do what you'd rather not. So folks, it's up to you and it's up to me. Lights on. Thank you very much. If there are some questions, I'd be delighted, or comments, or both, I'd be delighted to try to answer any.
What part does aspirin play as a medicine?
The question is, what part does aspirin play as a medicine? Aspirin costs a penny a day. It's a magical drug. Today, if you walk into a hospital and have a heart attack in the emergency room, most places put an aspirin tablet in your mouth in the emergency room. I'm pushing to also put a cholesterol-lowering drug in your mouth at the same time. There's some good studies now that show that people who take aspirin, you don't have to take much of it, and it's not clear whether you should take an adult aspirin tablet or a baby aspirin tablet every day, that it clearly, in groups of people at least, decreases the frequency of heart attacks. And in people who've had heart attacks, it decreases the frequency of subsequent ones. So it's a wonderful drug. It's interesting, unfortunately, that despite the fact that if you have that aspirin tablet put in your mouth when you go into a hospital with a heart attack in the emergency room, and you take it every day for the next 30 days, compared to a group of people who have a heart attack but they don't take aspirin, that aspirin reduces your mortality, or your chance of dying in those first 30 days, by 25%. And it costs 1 penny a day. It's a magical drug. Now, is one question, is that it?
What effect does the level of platelet count in the blood have on heart attack?
Yeah, the question, what effect do platelets have on heart attack? As you know, the components of the blood, they're red cells, they're white cells, they're platelets, and then there's the serum. That's the liquid part of the blood. And these cells make up approximately 45% of the blood. Platelets, if the normal platelet count is about 200,000 or a little less. If your platelet count is over 1 million, it's of concern. It can stop up arteries. In other words, it can be associated with clotting if the platelet levels are very high. If they're very low, it also decreases the chances of clotting. Fortunately, very few people have very high platelet levels.
You didn't have Zocor on that list of medicine. Is it a good one?
Yes, yes, it was on there. Zocor is the trade name. The generic name is simvastatin. Actually, that's my favorite of all of those. Zocor is a slightly more powerful than lovastatin or fluvastatin or the other. I think it's a wonderful drug. I highly recommend it. Actually, that's the one I use preferentially. But I don't think it matters so much. The difference between Zocor and Mevacor and Pravachol and so on is very little difference. The important thing is to take them. Unfortunately, half of Americans who are put on a cholesterol-lowering drug quit taking the drug within a year. It's very sad. It's very sad. It's hard to keep people on drugs when they don't see effect from them. Now, I've got a little hip problem, and so I take a little medicine for this hip problem. Now, I don't miss, because if I don't take it, it hurts. But it's not that way when you take a high blood pressure medicine or when you take a cholesterol-lowering medicine. You don't feel the difference. So people say, well, why should I be paying us $1.50 for this pill? I'm not feeling any different. But let me tell you, decrease the quantity of meat you have on your plate and put your money, invest that difference in these drugs. It pays big dividends. Yeah?
High blood pressure, high cholesterol, and you lower it and you also eat properly, does that reduce the plaque?
Yes, at least experimentally to reduce the plaques, you really have to get that total cholesterol level down in the vicinity of 160 or 150. There's no evidence that that you can shrink these plaques by, let's say, if your total cholesterol starts at 240 and you bring it down to 200. Just by bringing it down that much, decrease your frequency of having a heart attack or a subsequent heart attack. But there's no evidence at that point that you actually arrest the formation of plaques or you shrink those that are actually there. Now, if, on the other hand, let's say you have a total cholesterol level of 240 and you bring that total cholesterol level down to 160 or 150, you shouldn't form any more plaques. And you should shrink the ones that are there. Now, I had, when I lived in Washington, a next-door neighbor. This fellow was 44, and lo and behold, he called me one day. He was having chest pain, and he had a heart attack. And fortunately, he survived. And at the time of his heart attack, his blood pressure was a little elevated, his cholesterol level was elevated, his body weight, he'd let himself go. He was smoking about 2 packs of cigarettes a day. He had this heart attack, and it was probably the best thing that happened to him. He lost weight, he quit smoking, he changed his diet, his cholesterol level came down from about 240 or so to 160. This fellow's smelling like a rose. So some of these events are not always bad. Some of us need a jerk sometime to change our ways. Now, you might ask, well, what do I eat? Am I a pure vegetarian? No, I'm not. I eat fish. I wish I were a pure vegetarian. There's no question that that's the healthiest way to go. But the point of all this, I think we should know what the ideal is. I don't think we as human beings were made necessarily to eat flesh. Now, that's not an easy thing to say in the Midwest of the USA particularly. And let me tell you, it's certainly not popular in Texas, where I'm from. Now, in Texas, let me tell you, Texas is the eat meat state of the country. There are more head of cattle in Texas than anywhere else in the country. Amarillo, Texas, which is in the Panhandle, they have a place in Amarillo where they will give you free of charge a 72-ounce steak. Now, that's 4.5 pounds of steak. And if you eat that thing in one sitting, they'll give it to you free. If you don't, you have to pay $50 for it. But things are big in Texas. Lots of flesh down there. Well, I like the latter. Vitamin E, I take vitamin E every day. I take vitamin E and vitamin C. I take one tablet, 500 milligrams of vitamin C, and I take 1,000 international units of vitamin E. Now the question is, these are antioxidants. Now these are vitamin tablets, of course, but they're just very high doses. What is the evidence that they prevent plaque formation? There's little evidence that they prevent plaque formation. There is some indirect evidence that they prevent occurrences of heart attacks. At one time, it was thought that they also reduce the frequency of cancer. Most studies have shown that they reduce the frequency of cancer. There was a study published about 2 months ago that it was quite different than any of the others. It showed that the vitamin A maybe even increases the frequency of cancer. The truth of the matter is, we don't know yet. Now, when I started taking aspirin about 25 years ago, the data wasn't in. But I thought it wasn't worthwhile to wait to get absolutely foolproof evidence. So I took it all those years, and I'm delighted that I did. I feel about the same way with vitamin C and vitamin E. There's no evidence of toxicity from these doses that might be useful from an antioxidant standpoint. So theoretically, I think they're good, but we won't know for quite a few years for sure whether they're useful. In the interim, I'm going to keep taking them. It's a little more difficult to advise other people what to do.
To what extent can we allocate our blood pressure per day? In other words, 140 over 90 is possibly normal. Can it vary higher than that at different times during the day?
Yes, it varies, no question about it. The question is, does blood pressure vary during the day? There are some ambulatory monitors now that you can put on, and it'll record your blood pressure throughout the entire day. And I used to, when I was at NIH, I had one of my fellows take my blood pressure a lot, trying to get at that. And I would wake up in the morning, my blood pressure would be about 110 over 80. I'd go to work and have my first cup of coffee, it'd be about 125 over 80, and then I'd have the third cup of coffee and start moving around and get annoyed with something, and then it'd be 140 over 90. Blood pressure clearly does vary. Now, what can be done about it? When my blood pressure started getting 140 over 90, I said, this is crazy. I don't want to have a stroke. Stroke is an awful thing to have, and stroke is related to blood pressure. People who have blood pressures 120 over 80, 90 over 60, they just don't have strokes. So the first thing I did was throw away the salt shaker. Now, most of us who use a salt shaker, about 15% of our salt comes with salt shaker. So that's not enough. That's not getting rid of enough salt. But these processed foods, they're the ones that are loaded with salt. And I used to think I just didn't like anything unless I put a lot of salt on it. But it's what we get used to. And if you use a lot of salt, I suggest to you, stop and just fight it for about a month or so, and then you won't want that salt. And if you keep that salt intake down, it does have an effect on blood pressure. There's no doubt about it. There are other factors, but if your blood pressure stays over 140 over 90 or so for some time, you ought to be on medicine. That's a very treatable condition, and there are many different medicines that are very effective.
I know you said that people who were on low cholesterol drugs, after took them a year and then they went off, and that was completely wrong. What if you are on a drug for 4 years and you got your cholesterol down under 200 and you would like to go off the drug? Should you?
Well, what do you mean under 200? Do you mean 199 or 150?
185.
185. Well, if you look at people with blood cholesterol levels 150 and look at those with 185, the risk of having an atherosclerotic event is greater at 185 than it is at 150. Now, the truth of the matter is, if all of us could get our percent of calories from nearly 40% down to 10%, in other words, if we could quit eating over 100 grams of fat a day and eat less than 50 grams of fat a day, we wouldn't need any of these drugs. But most of us are not willing to do that. And I'm an advocate of really pushing that cholesterol thing down. Most of us, when we say we're going on a low-fat diet, well, you know, it's not very low-fat. It's just compared to what we were used to. And some of us, you know, may have been eating 200 grams of fat a day, and we knock that down to 140, but that's still terrible. The best monitor, in my view, is body weight. And we all have to decide, and it's tough. My ideal continues to go up just a little bit, but I think all of us need to know, what is our ideal body weight? And are we willing to do what's necessary to keep it that way? And that means diminishing the quantity of fat. Now, in my house, the scales, and I have some good scales with a mast on them, you know, they like doctor's scales, not those bathroom scales. They're never accurate. You know, you step on them, then you don't believe the scale. But these scales in my house are right next to the refrigerator door. And so if I get on those things and I'm over my number, I just don't open the door. But I think we got to be tough on that. You know, get your number and decide whether you can live with it or not, and do it. It's not easy. But I eat better now than I did 20 years ago. And I don't eat nearly the junk I ate 20 years ago. No way. And, you know, we all, no matter what you do about eating, we're going to all cheat. Come certain holidays and some, we're going to eat more than other days. But the way I try to do is figure out your calories per week, just like you figure out your dollar budget per week. So if you're going out on Sunday to have a big roast or something, go light on Saturday or go light on Monday. So your total calorie count over this 3-day period is not any more than it ought to be. In other words, when we're going to have big fun, when we're going to have that 3,000 caloric meal, let's plan it. Just like when we're going to have a big vacation, we save our dollars up to go on it. Same with calories. Some people say, well, I can't count calories. Well, they can count dollar bills. I'll say you can count calories too then. Yes, ma'am.
Does a high HDL and a good ratio make any difference in the overall cholesterol?
Yes, it does. HDL is very important. In my view, it's, well, put it this way. If your LDL is elevated and you bring it down, there's no question that the risk of having a first heart attack or a subsequent heart attack diminishes. Now, if your HDL is low, we don't have the evidence yet that if you raise it, that person will decrease the frequency of an initial heart attack or a subsequent heart attack. On the other hand, people who have heart attacks often have low HDLs. When I was at NIH, we studied this patient one time who had a total cholesterol of 72. And lo and behold, this fellow had a heart attack. His total cholesterol level was 72. HDL was. In other words, he had no HDL. So it's very bad in that circumstance. Now, women have HDL levels a little higher than men. The average in men is about 45, and women is about 55. Now, there's some women who may have so the ratio is 3, the ratio of total to HDL. Well, that's, nobody knows for sure what to do with that particular person. When I and I know I'm looking at a woman. That never happens to a man. No men ever have an HDL of 100, that's for sure. Usually, though, if that person walked into my office, I would treat them. I think the LDL is too high in that person, and I would still work on the LDL. Now, the one thing good about HDL is that exercise tends to raise it. You've got to do a good bit, but it tends to raise it. If you're heavy and you lose weight, it raises the HDL. If you smoke cigarettes and you throw them away, it raises the HDL. So that's something that's quite responsive to what we do. And there's no doubt, the higher the HDL, the better off we are. Yes? I missed that, I'm sorry. Garlic, yes, it's good. Garlic, onions, may not smell very well, but eat them anyway. Yeah, they lower cholesterol, they're good.
If you exercise, my blood pressure is okay when I'm sitting still, but if I start walking and my blood pressure goes sky high.
Well, that's okay. Exercise can do that. You run on a treadmill and your blood pressure can shoot up, but overall it'll come back down and it'll stay lower than if you don't exercise. I used to be a runner, and boy, it was wonderful. My blood worry about it, not the reverse.
We've got time for a couple more questions. By person down there, yes, the person up here.
Yes, I want to know about women in estrogen. What has it shown about heart?
Yeah. Well, this is another controversial issue. It's like the antioxidants of vitamin E. And the question is, what about estrogen? In the postmenopausal woman, are estrogens good? Well, estrogens in general lower the total cholesterol and lower the LDL cholesterol about 10%. And I'm of the view it doesn't matter what you take to lower it, that's good. And there are a lot of studies that show that estrogen in postmenopausal women are very good for decreasing the frequency of heart attack and decreasing the frequency of problems from osteoporosis, etc. Now, the drawback of estrogen is that the frequency of uterine cancer increases. Now, there are some studies that tend to show that estrogens in postmenopausal women decrease the frequency of heart attack about 50%. Now that means if there are 300 heart attacks in women per year, that might reduce that to 300,000 to 150,000. That's pretty good. Now, uterine cancer, normally there's about 5,000 uterine cancers a year. Well, if you're on estrogen and you still have a uterus, it raises that about 3 times. So it increases it to about 15,000 uterine cancers a year. Now, if you're talking to 100 people, 100 women, it's sort of easy to make the decision. But when you're talking to one, it's a little less. Now, my own view is if a woman has had a hysterectomy, it's very easy to make the decision on estrogen. I would go for it. If the person is not on, has not had a hysterectomy, and there's no family history strong of cancer of the breast in that person's family, I would tend to advocate estrogens also. If there's a strong history of breast cancer, it's a problem, or potentially can be. There's a new study from Scandinavia just last year that brought up this breast cancer. It was the only study that showed an increased frequency of breast cancer from estrogen therapy. Others have not. I think it's going to be the way to go. But there's a major study underway now with thousands of women participating, and we won't know the answer to that question for certain for about 5 or 6 years. It's just like vitamin C and vitamin E.
Within an hour and 10 minutes worth of high-tense aerobics exercise 5 days a week for an hour and 10 minutes, would that help relieve some of the plaque?
You mean shake it loose? Or, no, I'm teasing with you. But look, exercise, there are all kind of benefits of exercise. They make your HDL go up, they make you feel better, they make you sleep better, make your gastrointestinal tract work better. Fewer people who exercise go to psychiatrists compared to those who don't. Keep doing it. Makes you happy.
We've got time for one last question over here.
Dr. Ross, the past 2.5 years, I've been donating braces to Red Cross every 2 weeks. And it appears to have a slight lessening in my blood pressure overall. For example, in the past year, I normally test somewhere between 110 and 120 over 70 to 80. And in one occasion, I tested 90 over 60. And yet I've been gaining weight. And contrary to your recommendation, no red meat, every time I come to iron test, I come to eat red meat. And I'm wondering if there's been any research done to see if there's pumping action where they extract the blood and pump it back in this pheresis procedure, if it has any cleaning effect of the arteries.
I can't answer that. I'm not well versed in that. I can tell you that there are a group of people in this country and elsewhere who have what is called homozygous familial hypercholesterolemia. These are people with really a bad cholesterol gene. They have no receptors in their liver, so their total cholesterol levels are in the vicinity of 1,000. And 1,000, I mean, at birth. And these children, on the natural course of things, die when they're 12 or 13 or 14. Now, fortunately, there's only 1 per million of the population, so we only have 260 of these people in this country. But that's one of the therapies for them now. They can have a lot of cholesterol brought out of their system by doing that. But I have no personal experience with that. Your blood pressure is good, sir. Just keep it that way. Now, a lot of people who gain weight, their blood pressure goes up. If you can get that weight back down, it'll lower the blood pressure. Body weight's a wonderful thing to follow. Folks, it's been a pleasure to be here. Thanks for your attention. What do you... Okay.
Very good. I'll take it.
What
As
did you
usual.
say, huh?
No.
Thanks again, Dr. Roberts. I hope next time you come back it'll be more relaxed.
Yes, sir.
Have a good trip to Cleveland.
Hey, Dr. Galvin.
I did my residency at St. Luke's, which is close to the clinic. Yeah.
Yeah, in Houston?
No, St. Luke's in Cleveland.
Oh, St. Luke's in Cleveland. Oh, I heard the other day that St. Luke's and Methodist in Houston are going to combine.
I know. That was big news. That'll be a huge.
Methodist has $1 million in the bank, I was told. St. Luke's almost.
Can you imagine?